Hi, I'm Dr. Philip McMillan, and today I just wanted to update you on some information that came out of a recent Senate hearing looking at COVID vaccines. And you can imagine that this is a controversial hearing because it is going against the narrative, especially with regards to safety issues. I haven't watched the full Senate hearing, but I have recently come across a short interview with Aaron Siri. He's a lawyer and he is perceived by many in the scientific community to be one of the challenges or challengers on behalf of informed consent. It's ICANN, I've forgotten exactly what it means. And they challenge issues around vaccine safety. So his natural position is challenging vaccines, and this is even before COVID vaccines. That aside, he recently said something that came out from a Freedom of Information Act. They had to force the CDC to release this information. And that in itself, I find very concerning about the VSafe, the vaccine monitoring system that they had in the US. What I'm going to do right after I remind you about our upcoming conference, just so you don't forget, coming up on the 31st of May, we have our hidden drivers of post-COVID dysfunction. And you have to remember that this conference is looking out for all the issues that everybody wants to forget. We're trying to understand it and try and bring it together. So, as I said, giving you the context with regards to Aaron Siri, listen to what he has to say in this short interview, and then I will add a few thoughts. Here are his words.
I'm here with Aaron Siri, an attorney that testified today for Ron Johnson's Senate hearing on the vaccine. Could you tell us what you testified about?
Absolutely. Well, first, I testified about the vSafe system. That's CDC's premier vaccine safety system. They spent a year and a half telling the country this system confirmed that the COVID vaccine was safe. They published study after study using this system, but only disclosed the data from the first week after the injection that people reported they needed to get hospitalized or emergency room and so forth. Well, on behalf of our client, the Informed Consent Action Network, we sued the CDC. And it took 2 lawsuits, a year and a half. When we finally got that data, what it showed was that actually 7.7% of the 10 million vSafe users, most of these folks are folks who signed up the first 6 months.
Just pausing you here a minute. Firstly, they had to sue them, the CDC, to get this data. That alone is concerning. And it took them a year and a half to get this data. And you have to remember that this data was used to demonstrate safety across many papers. And what they were looking for was the fact that they were looking for an early signals about issues with regards to the vaccine. And so their argument was that it was designed to pick up issues in the first week. It wasn't designed for beyond that. You had the VAERS system and other vaccine reporting injury systems out there. The point being, though, is that what they probably didn't anticipate would be that 7.7% of the almost 10 million users would continue to put information in about their issues. The longer it goes from the vaccine date, the harder it is to connect it temporally, meaning that if you had it 3 months down the line, is it something else? And so this is part of the reason why they were arguing against sharing that, because they thought that this would give a false impression about the safety. So they were defending the position of the vaccine. My concern is that 7.7% clearly overwhelmed their capability, because nobody would have anticipated that many people would be putting in issues. But let's hear a little bit more about what he was saying.
After the vaccine was rolled out, these were the folks who were enthusiastic about getting the vaccine, reported needing medical care, and on average, 2 to 3 times each, and 75% of those reports were for hospitalization, emergency room, and urgent care. Those are very serious numbers. And
again, he is right. Those are very serious numbers. 75% needing hospitalization, a doctor visit, or urgent care. Now, some of that could just be a temperature, but that could cover a whole range of serious issues that need to be dissected. And one of the problems the CDC had, I think, was that a lot of what was put in there was free text, meaning that it wasn't a simple click a button. People were typing in what was happening to them. And so then suddenly it's very hard to code it. And so you need lots more people to try and code it and to respond to it. So they were clearly overwhelmed in the context of the amount of responses they were getting as free text, where people could be saying anything. You know, I've got a temperature, I was admitted with abdominal pain, I had a heart attack, I had myocarditis. And it suddenly gets very difficult to make sense of all the data. My concern is the percentage, 7.7%, 2 to 3 times for some people putting in data. That is extremely concerning. Let's hear a little bit more.
And you can see precisely why CDC did not want to disclose them, because it does not fit their policy. That's what CDC is. They're a policy organization. They're not a science organization, not a medical organization. Their policy that vaccines are safe and effective. And so instead of being transparent with the American people, showing them that data, we had to claw it out of them after 2 years of litigation almost. And what it showed is that the dozens of their so-called vaccine safety studies that they publish in journals are all basically misleading.
Again, I'll pause you here. What he's making reference to here is a very important point. And this is why I'm talking about it, because part of the reason why I have, some people would expect me to come out completely against COVID vaccines, especially because of my research into autoimmunity and spike protein autoimmunity. But part of the reason why I have taken that kind of position, at least early in the pandemic with the high risk, but even now, was that these numbers are relatively small, even though they are serious. And that was based on these studies pointing out that only a tiny fraction of people had any kind of issues, even though that was still relevant. And it didn't fit the real world issue because hospitals were overloaded, lots of people were getting sick, and you're thinking something doesn't make sense because it doesn't seem to fit just with the infection. But you had to trust the data. The problem here is that what seems to be being done is that it's not false data. It is just the way that you use the data to obfuscate the truth. Meaning that if you've only taken the first week in relation to the vaccine, probably after the second dose, I'm not sure exactly when, you then will have only a percentage of the issues, especially in the context of autoimmunity, because that takes longer to present than just simply an allergic reaction or a bit of temperature. Let's hear the final bit that he has to say.
Because they only published the first week after the shot of people seeking medical care, even though they know that COVID vaccine injuries can happen well after the first week. And when we got the data and we could see the first 6 weeks of reporting, as well as 3 instances after that, it's like I said, 7.7% of users, 2 to 3 times each, seeking serious medical care.
And all of this information is now coming out that the Biden administration knew about the vaccine side effects like myocarditis, and they were hiding in that. Why do you think so many politicians, specifically for whatever the reason, Democrats and some Republicans, are still so fixated on pushing the COVID-19 shot?
I think that to really understand COVID vaccines or any vaccines, you got to really understand the last 40 years. When they gave immunity to vaccines back in 1986
I'm going to pause it there because he goes on to an important historical point about vaccine immunity, which I think is important, but not what I want you to focus on. What I want you to think about is that if the data is even a fraction correct, Because when you look at many other vaccines, we're talking a tiny fraction of short and longer term issues. 7.7%, where some people 2 to 3 times are putting in free text information about doctor, urgent visit, hospitalization, is extremely serious. That is way beyond anything I've seen in any paper. And it is incumbent on the medical and scientific community to understand what that is about. And so it puts more pressure on that question to public health organizations across the world is, are there enough benefits to warrant the risk? That really is the question that has to be answered. And so data like what is coming out of that needs to be looked at by every public health organization to make sure that the risk-benefit analysis has properly been done. That's a challenge that they face, because now this is in the public arena. There is no way to pretend that you don't know. So that's the point for today, just keeping you up to date with what's happening in terms of the science and the challenges ahead. Just a final reminder, the description below, that you will see that all the links are there for you to join us, where we're looking at hidden drivers for post-COVID dysfunction. Please join us. That way you will not miss it, and you will get a link and a reminder about it. Here is the quick reminder of the conference. I look forward to seeing you there.
Hi, I'm Dr. Shankara Cheji. I'm a general practitioner from South Africa and a frontline doctor, and a panelist on the Hidden Drivers of Post-COVID Dysfunction conference. I look forward to seeing you all at the conference.
Hello, my name is Brigitte König. I'm from Germany, and I'm a professor of microbiology and infectious diseases. And I look forward to see you at the conference.
Hello, my name is Marcus Klopp. I'm the founder and director of the Friese Center, the world's first purpose-built long COVID and post-vac and chronic illness clinic in Cyprus. And I'm looking very much forward to see you at the conference.
Hello everyone, I'm Risha Pretorius. I'm from Stellenbosch University. I'm a professor in the Department of Physiological Sciences, and I will be sharing some of our insights into microclotting and vascular health in long COVID, and I'm looking very much forward to seeing you at the conference.